Hello, everyone. Welcome to Do Toilets Save Lives, hosted by UMD Global Public Health Scholar students Esther, Natasha, Bersaba, and Alyssa. Today, we will be discussing an intervention that tackled open defecation in Indonesia, specifically in its rural communities. Open defecation, the practice of using bathrooms in open fields, has contributed to the sanitation crisis in Indonesia, in addition to the lack of safety for women and children. In fact, the CDC states that before the intervention was implemented, there were 50,000 deaths and 12 million illnesses that resulted from poor sanitation each year in Indonesia, leading to the economy losing billions of dollars. The previous governmental interventions enacted during the 20th century failed and were heavily criticized for widening the disparity gaps in Indonesia due to the fact that the sanitation facilities were only accessible to those who could afford living in certain neighborhoods. It did not help that the government did not prioritize the sanitation crisis in their budgets. However, in 2003, the Indonesian chapter of the World Bank's Water and Sanitation Program created the Total Sanitation and Sanitation Marketing Program, which was a branch of the community-led Total Sanitation Program. This intervention focused on motivating community members to stop practicing open defecation through provocative demonstrations, such as modeling fecal contamination. The program also distributed catalogs that weighed different sanitation methods and materials that would discourage people from practicing open defecation. The marketing aspect of the program also made sure that they trained locals to construct latrines at a low cost. However, the program did not stop there. The intervention had advocacy and policy components to increase the support of local and national government funding for the program, as well as to incentivize achievements.
So now we are going to talk about the pros and cons of this intervention in Indonesia. So a pro for this program was that there was increased awareness of the health dangers of open defecation, and there was also strong emphasis on safe sanitation and the use of toilets. And the number of cases of diarrhea and lower respiratory infections for children was reduced. And there's empirical data that shows an improvement in sanitary health as a result of this program. And to be more specific, data shows that diarrhea and low respiratory infections for children decrease. And that is I think, a very significant pro for this intervention.
Another pro of this intervention is that this program made its arguments for why the residents should practice safe sanitary practices using easy to comprehend visuals rather than talking down on people or using vague and daunting literature, figures, and more. For example, they made it so that those who were illiterate could understand the message in a visual manner. Also, there was a shock factor in visuals and demonstrations, which compelled residents to improve sanitary practices and demand better conditions.
With the various benefits that the Total Sanitation Program brought to Indonesia's most needy residents, there are also various shortcomings to be addressed when evaluating the intervention. One of the first critiques of the intervention is that it could have been implemented in a better way. This intervention was designed to trigger feelings of shame and disgust, including coercion, using lack of respect, which could deter people from participating. This could also lead to further alienation of the population. Another critique is that the intervention could have included educational programs in schools and other community establishments rather than just relying on educating people through shaming and demonstrations. Allowing the community to have more autonomy would have been vital in increasing engagement.
The program also did not reach as many people as we would have hoped because the government did not increase the funding towards sanitation, so it couldn't be implemented across the country, and it didn't catch the eye of international investors, especially because the government didn't want to invest in the program. Therefore, toilets weren't accessible to all. Poor households, in fact, could not afford toilets even after the program. So only better off households were able to afford toilets because they were able to pay for the construction of the improved sanitation system. To hear more about an expert's thoughts about the intervention, we will be interviewing Dr. Sapkota.
Okay, so we have a wonderful guest appearing in our podcast today, Dr. Sakota, who's a professor for the School of Public Health at UMD College Park. We were first introduced to Dr. Sakota when she was a guest lecturer during our Families and Global Health class on World Toilet Day. In her lecture, she focused on water sanitation and sustainability, which relates to what we're going to discuss in our podcast today. It's great to see you again, Dr. Sapkota, and thank you so much for coming.
It's my pleasure. I'm happy to be here with you.
So we have a couple of questions for you regarding the outcomes of the toilet intervention in Indonesia. One of them being, based on your experience, do you think this intervention was successful? What factors do you think prevented or let this intervention be successful?
Sure. So I reviewed the case study in Indonesia that you'd sent to me. And I think if you look at the big picture, they did have a lot of successes with this program. I think in terms of their numbers, about 23% were more likely to build toilets in the intervention communities or in their triggered villages. And I think they saw around a 10% reduction in the practice of open defecation. I think from a public health outcomes perspective, it looks like the intervention also resulted in about a 30% reduction in the prevalence of diarrhea. So those are all numbers in the right direction. So, you can see that the program did have some successes. I think they also do have a long way to go, though.
Okay, so another question we have is if you could go back and change how the intervention was implemented, we're curious about what would you do?
Sure. I think there's a couple of areas where they could improve. One, and this was discussed in the case study, one area that I guess critics sort of focused in on was they felt that perhaps using sort of some shaming methods where they were shaming people about open defecation maybe might not have been the best way to really get the community engaged. So perhaps it would have been better to have more of an education focused campaign where the educators really got that message across, that linkage between open defecation and negative health outcomes, because I think that linkage, that connection is often lacking, where communities don't realize that open defecation really is contributing so much to the prevalence of diarrheal diseases in their communities. So perhaps if they used a slightly different way to engage villages early on, they may have had more excitement or buy-in by community members. Another thing that happened with this study is, I think the folks who were involved were very, very well aware of this, that despite their efforts and despite the funding that they had for the study, they still saw that folks who were poorer and at the lower end of the economic spectrum were not engaged really, and very, very less likely to construct a toilet. And so, this speaks to the overall big challenges with, getting people to stop open defecating and getting people to use improved sanitation or toilets is, the economics of the situation, the governance of the situation. So these really need to be addressed head on to try to ensure that you don't have inequities where people who are more well off are the only folks that the intervention reaches versus those who are very poor.
So relating to that, in places where the intervention failed to close the disparity gap in sanitation among middle-income Indonesians and the poor, how ineffective was the reduction in prevalence of sanitation-related diseases like diarrhea, for example? What other methods could have reduced prevalence outside of this intervention?
Sure. So, and you may have seen this in other sanitation related interventions where oftentimes instead of just providing toilets, there will be a combination program where the goal of the program is to not only increase the use of improved sanitation or toilets, but also increase hand washing. So hand washing is absolutely the single most important thing that any of us can do to lower our risk of really any type of infectious disease, whether it's a diarrheal type disease or even an upper respiratory disease like we've seen with COVID-19. So it may have helped to include a hand washing campaign in addition to their toilet campaign. But I think at the heart of it, though, if you want any of these interventions to work, it really needs to be an intervention that is community engaged, community driven. It really is not going to be as effective if you have folks coming in from the outside providing an intervention. It has to be something where the intervention is supported from within the community at all levels of it, in terms of education, financing, all different aspects of the intervention really need to be community driven, community engaged in order for it to be sustainable over time.
Overall, this intervention took a step in the right direction. However, more has to be done in order to make this program more effective, not just in the rural communities of Indonesia, but also in other countries. Open defecation is still a severe health problem worldwide, and there are still millions of people out there who do not have access to proper water sanitation and toilets. However, there are ways you can help to reduce the prevalence of open defecation and aid people in Indonesia and other impoverished countries to have access to clean hygiene facilities. One way you can help is to donate money to organizations that focus on improving the water sanitation and toilet crisis globally. The World Toilet Organization, WaterAid, UNICEF, Sanitation First, and Toilet Twinning are just a couple of organizations you could donate to. For more information on this intervention, visit the Center for Global Development's online article on Indonesia's toilet sanitation and sanitation marketing program. Thank you so much for listening, and hopefully you can decide whether or not you believe toilets can save lives.